Hi everybody, David here, and today we're going to go after sciatic nerve pain. Sciatic pain, as you know, is absolutely no fun. And if you're watching this and you don't know what sciatic pain is, it's the nerve that travels from your lower back all the way down your leg. It can be on the outside of your leg or the back of your leg. It can wrap around into the hip. It can do a lot of things that aren't comfortable at all. It's nerve pain, which means it's really, really painful at times or just irritated. You can have some numbness, some tingling. And there are various causes of sciatic pain, but there are only a few postural causes. So what I mean by that is that sciatic pain can be caused from an impingement on the nerve from your lower back. That means there's a disc, a vertebral disc that is bulging out or poking out and hitting the nerve. If you've ruptured a disc, then the disc material is now hitting the nerve and irritating it, and you're getting pain down the leg. There are also other causes of sciatic pain or impingement. You can get impinged in your glute area. They call it piriformis. Piriformis gets blamed for a lot of things, but one of the things it gets blamed for is sciatic pain. Now, it's not the piriformis muscle's fault. The piriformis is a deep muscle in the hip. It's one of the external rotators of your hip joint. And you have to address the reason why it's tight, just like you have to address the reason for the disc herniation or the disc bulge. The reason is always, in the absence of blunt force trauma, means unless you got hit by a car or you fell off your bike or tackled by a 300-pound lineman or something of that nature, then it's a postural cause. And the postural cause is there's too much pressure on one side of your spine and too much work in one side of your hip. So there's an imbalance. There's an imbalance in the spinal muscles right to left. That means there's an imbalance in the pelvic muscles and in the shoulder blade position or function or musculature or all the above. It's this imbalance that we really need to fix and that we really need to address. And that's the key with working with sciatic pain. I've worked with hundreds of people with sciatic pain over the years, and I mean hundreds. And every one of them has a postural imbalance that is underlying this sciatic pain. And again, that's what you're going to fix today. Now that's the postural stuff. From an emotional component, you always want to ask yourself when you get incidences of pain like this, what's going on in your life? Where's the stress in your life right now? And I think you're already telling yourself you know what it is. There's something going on in your life that's causing emotional stress, and that's creating more stress on an already compromised body that's being compromised by a postural misalignment. So this emotional stress, you want to address it. Whatever is going on in your life, a lot of times it's fear. It's fear or apprehension of moving forward in your life, doing something or something that you're really angry about that's going on right now. And that anger is being represented in this really angry nerve pain. So address any anger that's going on in your life, address any real emotional stress to the best you can, and I guarantee that it'll take some pressure off this sciatic nerve. In the meantime, we'll give you some exercises to help take the pressure off from a postural standpoint. So here we go. Okay, first things first, I'm going to tell you that if there's any pain doing any of these exercises, stop. Okay, or if it feels like it might go away in a minute, then you can wait it out. If it doesn't go away, or if the pain increases at all, you want to skip the exercise or stop altogether and take a break. Okay, so as we go through this, I'll talk about what the exercises are doing and how it's affecting you. But just remember, if there's any pain, take a break or skip that particular exercise. There shouldn't be. So here we go. First, remember I talked about we're going to address the postural misalignment and the imbalance that creates pressure on one side of the spine or one part of the hip that causes sciatic pain. So what you're first going to do is find a chair or a couch or anything that puts you at about 90 degrees. So you can see here that my hips and my knees are at about 90 degrees. You want to relax your shoulders, relax your arms, palms up out to your sides. And you want to breathe. Inhale, let your stomach rise. Exhale, let it fall. And you just want to hang out here. Now this position in itself should feel pretty good. If the pain increases temporarily, see if you can wait it out for a minute and see if it starts to improve and get better. If it shoots up and it's just starting to get worse and worse and you got to come out of it, come out of the exercise and wait for a few minutes. And we'll get into some other exercises that should feel better. But for now, hopefully this feels good and you're hanging out. And you want to wait this out for a couple minutes. And by a couple minutes, I mean anywhere from really 2 to 10 minutes if needed, so your body can just settle. What we're doing here is we're letting gravity do the work and the ground serve as a reference for straight. So we're balancing out the spinal muscles right to left and top to bottom. And that's hopefully taking some pressure off of this sciatic nerve. Now, what you're going to do is you're going to find a pillow. Grab a pillow from your couch or from your bed. Anything you have that's handy. A yoga block works. And you're going to, if you have a pillow from your bed or couch, just fold it in half. You want it, I don't know, about 6 inches wide. Put it between your knees. Relax your shoulders, and you're just going to bring your knees together on this pillow and release. So you're squeezing this pillow, squeeze it, release it, squeeze, release. Now don't let the pillow fall. You're going to keep some constant pressure on it so the pillow stays where it is, but you're going to pulse on this pillow. Squeeze, release. Use the inner thigh muscles to do the work. Relax your hips, and you should just notice your knees are moving, not your hips or your back. Just your knees. Squeeze, let it go, squeeze, release. And as you're squeezing this, you want to focus on the work being equal inside both legs. So try and get the inner thigh muscles working equally to the best that you can. And you're going to do about 60 squeezes. And yes, your inner thigh muscles might get tired. What we're doing here is we're working on balancing out the hip muscles that attach into your back to help create balance in your spine and take the pressure off that nerve. Squeeze, release. You're just squeezing, letting it go, squeezing, letting it go. And yeah, you're going to feel the work in your inner thighs for sure if you do it long enough. And the squeeze you don't want 100% effort, you want maybe 70% squeeze. You want a pretty good squeeze in there, but you're not trying to break the pillow. Okay, next. Once you've got 60, take the pillow, move it away. Relax your knees. Let them relax. Let them fall out away from each other. You're not trying to hold them up, hold them straight. Relax the knees. Let them drop away from each other. And again, you want your hips and knees as close to 90 degrees as you can get them. Okay, next is you're going to put your arms up like goalposts. So elbows on the ground, level with your shoulders. Back of your hands down on the ground if you can. If you can't get your arms and hands in this position where the back of your hands are on the ground, then get them wherever you can and just hang out here. Okay? If you can get them on the ground, or even if you can't, you're close enough, or wherever you can get them, you're going to take your hands, you're going to keep your elbows down and the back of your hands on the ground. You're going to slide them up overhead until your fingers touch over your head. And then you're going to glide them back down. Now again, if your hands don't touch the ground, just do the best you can. Try and keep your elbows down, reach up as high as you can, and back down. If you can't put your hands on the ground, your hands are sliding up till they touch, going back down, sliding. You're going to keep your fingers spread. You're going to keep gliding those arms and elbows up. Elbows bent 90 degrees. You're going to feel some work in your upper back, maybe in your shoulder blades. Maybe your mid-back, maybe in your shoulders. You might be feeling a stretch on the front of your shoulders or in your pecs, which is the front side of your chest. You're going to do about 20 of these. You're just going up and down, sliding. If you can't get your arms to move at all, then just hang out right here and just breathe. If you can get your arms to move, this is what you're going for. Okay, just 20 of those. I've probably got, I don't know, close to it. I'll do a few more. Just glide it up best you can. Try and touch your hands up overhead. As this gets easier, you can reach up a little higher over your head, but keep the elbows and the hands down. Okay, next. Interlace your hands together, palms together. And you're going to pull your hands all the way up overhead, keeping your elbows straight, and go as far as you can without bending your elbows. Okay, so you're going to keep the elbows locked, push those hands up towards the ceiling, and pull those hands back. Just up overhead, you're gliding these shoulders up and back, Now, why are we doing these two exercises? These exercises, remember what I said, that with sciatic pain, there's always a scapular imbalance, meaning an imbalance in the tension or function of your shoulder blades, as well as an imbalance in the hip muscles. So we're going to go after both. The hip muscle imbalance, the scapular imbalance / shoulder blade imbalance, and that will help balance out the spinal muscles. It'll help realign your shoulders and your hips and take the pressure off that sciatic nerve. People think that the cause of sciatic pain is a disc bulge, a disc herniation, or piriformis tension or glute impingement. Yes, that is what's impinging the nerve. However, like I said, unless you've had trauma somewhere where you fell off a bike, you got hit, you were jumped on by your son as you were playing or something like that, I've heard that happen, then it's postural in nature and you can solve that for sure. Your body's designed to heal. Okay, about 20 of those and then relax. Okay, you should feel much more relaxed. You should feel much more settled here. And now we're going to go to the next exercise. So for this one, you're going to want to find some wall space. Move this. So you're going to put your feet on a wall or a door or something like this. You're going to stay on your back though. Feet on the wall. Knees bent about 90 degrees. Relax your arms. And you're going to take your right ankle. You're going to cross it over your left knee. Keep your left ankle, your knee, and your hip in a straight line. You want to make sure that your whole foot is across your knee. Sorry, your ankle is across your knee, not just your foot. You want the ankle over, and then with your leg muscles, push the right knee towards the wall away from you. You're going to feel a little stretch in this right hip. Relax your shoulders and breathe. Now, what you want to make sure you do as you push this knee away is don't let this left hip slide out to the side. Okay, if this is causing any pain, then you want to stop this for now and we'll go to the next exercise in a second. But you want to keep these hips stable and still. As you push this right knee away, make sure the hips don't shift out to the side. And if you need someone to check you out, to look at you to make sure you're being straight, then do that. Okay, we're going to switch legs. You're going to hold each stretch for about a minute. Left ankle over the right knee. You're going to push this left knee out away from you. Relax your shoulders. Notice that one side may feel tighter than the other. That's pretty normal. I should say common. Doesn't make it okay because we want it balanced. But we know that one side is going to be tighter than the other if you've got sciatic pain. There's going to be a difference in tension from one side to the other, and that's the whole point of doing these exercises. Knee pushes away from you. Relax those shoulders. Don't let them help. And again, about 1 minute here. What we're doing is we're addressing the pelvic rotation and the muscular imbalance and disparity that's going on between the two hips. All these hip muscles attach into your spine, so if there's an imbalance in the hip muscles, there's an imbalance in the spinal muscles and in the spinal tension. Okay, now separate your feet about just outside hip width. Feet are going to point straight up towards the ceiling. Bring your knees together till they touch. Let your knees drop all the way out. All the way together, all the way out. You're just going to roll to the inside of your foot, roll to the outside of your foot, let your knees come apart. You'll notice that as your knees come apart, your lower back arches. As your knees come together, your lower back flattens. That's normal. We're doing sort of a pelvic tilt here, but we're instigating the pelvic motion with your hip muscles. So knees coming in, knees coming out. We're teaching the pelvis, the hip joint, and the spine that they're designed to work together as a unit. We're balancing out these hip muscles and, of course, these spinal muscles. And with the goal of, again, taking the pressure out of this sciatic nerve. Here we go, all the way together, all the way out. Knees are at 90 degrees at the hip. Just back and forth. About 20 of these in and out. Okay, if those get too easy, you could always move your feet out wider and do the same thing, just with your knees a little wider out, or your feet a little wider out. Okay? So, next exercise. Now, what you want to do is you want to stand up for a second, see how you're feeling just after those exercises. If you feel great, excellent. That's a great start. I've got a couple more exercises for you here though, and this is going to depend on kind of how you feel in this position. So you're going to go on your stomach. You're going to get 2 pillows, or if you have 2 shoe boxes, even better. Yoga blocks work as well. What you're going to do is you're going to lie on your stomach. You're going to, I'm going to move this out of the way. You're going to lie on your stomach, and you're going to put your arms up on these blocks. So your right arm is going to go right elbow level with your right shoulder. Relax your hand. Toes together, heels out. Your left elbow, same thing as your right, straight out from your left shoulder. Hands relaxed. Toes together, heels out, and you're going to rest your forehead on the ground. You're going to relax your shoulders, relax your heels, toes together, heels out, relax your butt, and you're going to hang out right here. Now, what is this exercise doing? By the way, I'm talking, I'm lifting my head to talk. You just want your forehead straight down and totally relaxed. Now, as you're there, I'm going to talk to you because you're going to relax your shoulders. This exercise is disengaging the shoulder muscles. It's realigning your spine, realigning your upper back. It's balancing out the tension between the right side of your back and the left side of your back. So we're getting an entire realignment here. Now, if this is painful, see if it gets better after a minute or so. If the pain ramps up, you come out of it, or you stop, and you just do the exercises up until this point. If it feels good, then wonderful. Stay here. We're going to stay here. You're going to stay here for 5 minutes. I'm not going to stay here for 5 minutes today because I want you to do it on your own. But on your own, you stay here for about 5 minutes just relaxing. I know for some of you it's going to feel really easy. Others it's going to feel difficult. Just wherever it's at, just let it be. This exercise is wonderful to realign your body, realign your back, and take the pressure off of that sciatic nerve. Okay. Last exercise. You're going to come from there onto your hands and knees. Hands underneath your shoulders, knees underneath your hips. Take your hands, walk forward half a hand length. Move your shoulders forward over your hands so your hips are slightly, and notice I said slightly, ahead of your knees. You're not going into a modified push-up position. You don't want this. You do want shoulders over your hands, hips slightly ahead of your knees. Relax your feet, tops of your feet on the ground. And you're going to let your back sway, shoulder blades collapse, head drop. Elbows straight. Now, if this is painful in any ways, move your hips back towards your heels again. Take some pressure off. If it feels okay, great. Let your back sway. Your shoulder blades are going to drop together because you're dropping your chest towards the ground. Shoulder blades collapse, head down, and elbows straight. And let your chin drop towards your chest. You're hanging out here for 1 minute. This exercise is restoring the connection between your lower back, your mid back, and upper back. It's engaging these spinal muscles equally from head to head to hips. And it's realigning your shoulders, your spine, and your hips so that when you come up, the pressure should be much more evenly distributed throughout your spine, throughout your body. And hopefully this sciatic nerve pain feels much better. Let your head drop. Elbows straight. Just 1 minute there. Okay. Come on up. Just shake it out for a second. See how you feel. Walk around for a second. Again, and notice, hopefully the pain feels a lot better. If not, go back to the exercises that felt good for you in this sequence and repeat them. So if just the first exercise on your back with your legs up felt good, go ahead and do that again. If the first 3 or 4 exercises felt good, but not the one on your stomach or on your hands, just repeat the ones that felt good. And you can do this 1 to 3 times a day as long as you're making progress. Always pay attention to your body. Always listen to its messages. Pain should never increase and never get worse. If so, then this is the wrong sequence for you. And we'll have more sequences in the future, but definitely if it's not feeling good at all, then always helps to see a doc and get some advice from your healthcare practitioner, and they'll always have some good advice, and more knowledge is always better than less. So I hope this helped you though today, and I hope you're feeling much better. This sequence has worked for a lot of people with sciatic pain, which is why I present it to you. I wouldn't ever give you something that I didn't think was going to work. This definitely can work for many, many, many people, which is why I bring it to you. So again, thanks for coming. Thanks for joining. Much, much more where this came from, and I hope to see you again soon.